10-year-old boy is brought to the clinic with multiple episodes of skin abscesses that are not red or tender, despite being infected with Staphylococcus aureus. Physical exam reveals eczema, coarse facial features, and retained primary teeth. Lab results show elevated serum IgE and eosinophilia. Which of the following is the most likely underlying mechanism of this patient's condition? A. Defective IL-2 receptor. B. Deficiency of NAPH oxidase. C. Mutation in STAT3 gene. D. Impaired class switching of immunoglobulins, mutation in CD40 ligand. Correct answer, C. Mutation in STAT3 gene. Explanation: Jobs hyper IgE syndrome results from a STAT3 mutation leading to Th17 deficiency, impaired neutrophil recruitment. Features include cold staph abscesses, retained teeth, eczema, coarse facies, IgE eosinophils, and bone fractures. Question 2. A 10-year-old girl presents with a history of recurrent skin and lung infections, mostly due to Staphylococcus aureus, and eczema-like rash since infancy. Physical exam shows a broad nose, prominent forehead, and deep-set eyes. Chest X-ray reveals signs of pneumatocele formation. Labs: IgE, eosinophils, normal IgG, IgA, and IgM. Which immune cell subtype is most deficient in this patient? A. Th1, B. Th2, C. Th17, D. Regulatory T cells, E. B cells, C. SIN. Explanation: T17 cells are essential for neutrophil recruitment to infection sites. STAT3 mutation impairs Th17 development, susceptibility to bacterial and fungal infections, especially cold abscesses. Typical features include facial abnormalities, IgE eosinophils, and recurrent infections. Question 3. A 7-year-old boy is evaluated for repeated lung infections and eczema. He has a history of multiple fractures after minor trauma. On exam, he has retained primary teeth, coarse facial features, and non-inflamed skin abscesses. Genetic testing reveals a STAT3 mutation. Which of the following laboratory findings is most consistent with this diagnosis? A. IgE eosinophils. B. Normal IgE neutrophils. C. IgE eosinophils. D. IgA, IgE. E. CD19 plus B cells. C. IgE eosinophils. Explanation: Hyper IgE syndrome, Job syndrome, is marked by IgE and eosinophilia. Despite this, patients are prone to cold abscesses and severe infections due to impaired neutrophil chemotaxis from defective Th17 function.